Hello, I'm Andy Caputo, an orthopedic hand, wrist, and elbow surgeon and partner at Orthopedic Associates of Hartford. I'm here in our Farmington office today to talk to you about the recent implementation of telemedicine into our practice. Telemedicine is advantageous for all aspects of orthopedics, everything from spine, knee, hip issues, shoulder or elbow or hand issues. All these areas can be addressed through telemedicine, where patients can be diagnosed with problems and given advice on how to pursue treatment. In mid-March, just after the World Health Organization declared the coronavirus a pandemic, a dedicated group of our staff and providers took on the task of implementing telemedicine into our practice. And now we can comfortably say that we are well on our way with this new technology. Telemedicine is similar to Skype, where two people can communicate over an internet-based video conference, but on a HIPAA-compliant platform. From the safety and convenience of their home, patients can communicate directly with their doctor, physician, assistant, or nurse. This has been beneficial in so many ways. It reduces the number of patients in our waiting room, therefore more appropriate for social distancing. It allows us to follow our patients that may have travel restrictions or medical conditions that may make it difficult for them to leave their home. It is also extremely time and cost-effective for patients. Similar to an office visit where I'm actually seeing the patient in the office, we can do many things through a telemed visit similar to the office. We would ask the patient about their symptoms. We can converse relative to what's going on, what treatments they may have done at that time. We can do a review of systems and ask them for what other issues that they might be dealing with also. We can do exams with them too. And for me, a hand surgeon, I can ask patients to show me their hand, how much they can open and close their hand, show me the different swellings that they may be concerned with relative to their hand. They can point to certain areas where they would have tenderness, and I can be able to correlate that to their symptoms. We then could come up with a plan as far as whether or not do they need to come in, should they need to get x-rays. We can also prescribe medications, and we can also confirm the follow-up for the patient afterwards. Some patients that go about doing this want to get their next visit through telemed, and we would go ahead and schedule that for them. When we're going over treatment options, we can refer them to therapy and even send them links that can show them different exercises that they can do. We not only can show them some of the exercises about how to work on specific motions and stretches on their hand or their body, but also send them the therapy links, which actually can give them pictorial diagrams and give them instructions and home exercises. Patient satisfaction has been routinely tremendous, with most patients rescheduling their visit via telemed when appropriate. One important aspect that has made this possible is the willingness of Medicare and private health insurers to reimburse these telemed visits similar to an office visit. Prior to the coronavirus pandemic, reimbursement for telemed visits was severely restricted. Therefore, it was not previously popular. Hopefully, this method of patient care is here to stay, as it is very safe and effective. Its longevity will definitely be dependent on the continued cooperation of Medicare and private insurance companies to appropriately reimburse these telemed visits. Similar to a regular office visit, appointments for telemed are made by the medical executive assistant for each of the providers. On the day of the visit, patients will be actually put into a virtual waiting room, and this can be done by either a contact from the provider themselves or registration or the medical executive assistant for each of the providers. The patient would need a device such as a smartphone with a camera or a laptop or tablet that has video and call capabilities and has good Wi-Fi connections. They want to be in an area, a room that's quiet and secure and a place where they can be heard by their provider. From tough times can come great advances, and the coronavirus pandemic has led to a better understanding of social distancing, hand hygiene, and optimizing our own health. It has also led to the widespread implementation of telemedicine all across our country. Adapting to these changes has enabled us at Orthopedic Associates of Hartford to continue to provide top quality care for our patients. If you would like to book an appointment with one of our providers, please do so by calling their office directly. Their phone numbers are listed on our website, oahct.com. Thank you for your time and attention.